Okay, so hi, good morning everybody. My name is DHB Jugs, and today my medical team and I want to do a little presentation on asthma. But firstly, before we actually teach, we want to present this topic in a fun way using a video.
Our friend Maxwell's 1 in a million, but when it comes to breathing, he's 1 in 13. Yeah, he's just one of the 20 million who have a lot of trouble when the air isn't clean.
Do you know what I mean?
Shouldn't take for granted that breathing's automatic. Max knows better and he's 7 years old. It's no fun to be an asthmatic, sensitive to dust, dogs, dander, and mold.
Even air that's cold.
It's hard to take a breather when it's hard to take a breath. If you trigger an attack, it can scare you half to death. The asthma epidemic will only get bigger unless we recognize and eliminate the trigger. Know the warning signs and write a little letter. Working together, we all can breathe better. Kids like Max deserve to breathe easy. Can't afford to leave our little friends in the dust. Wipe out mice that leave them weak and wheezy. Getting rid of secondhand smoke is a must.
Clean air we trust.
Breathe and believe. Working together we all can breathe better. Breathe and believe. Working together we all can breathe better. Most of us laugh when we think about a tickle, but not when it starts to make your chest tight. Maxwell says it can leave you in a pickle when you cough, 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 coughing all night.
I hate coughing alright.
Wake up in the morning, don't wanna go to class. Way too tired when at night you toss and turn. Let's help Max find an answer that'll last, so we can be fit and healthy, ready to learn.
I'm ready to learn.
Breathe and believe. Working together we all can breathe better. Working together we all can breathe better.
Okay, so I hope you guys enjoyed the video, but now we are going to start. Okay, so what is asthma? So the word asthma has been heard so many times, but there are many who are still unsure of what the disease is and why it is so prevalent, especially in young children. So the World Health Organization, or the WHO, states that asthma is one of the most common chronic diseases, meaning that they last for more than 1 year among children, and in the Caribbean it is seen as a problem affecting the health of children that needs to be addressed. So firstly, asthma is a lung disease that affects or that causes difficulty breathing due to a bronchospasm, which occurs when the muscles that deliver air to the lungs become tight or constrict. This then limits the amount of air one gets. Then it causes inflammation, which causes the muscles that actually carry air to the lungs to become swollen. And lastly, it causes the production of mucus, which can block the airways. So because of this, your child may make a sound similar to a whistling sound, such as wheezing. And this usually occurs when the airways that actually carry air to the lungs become tight, and it is produced through exhalation or actually breathing out. So with asthma, there are two types. So you have intrinsic asthma, non-allergic asthma, which usually occurs in adults and is triggered by non-allergic factors like exercise, stress, smoke, and even an infection. Then you have extrinsic asthma or allergic asthma. It is usually triggered by pollen, food, dust, dander, and even pets, and it is most common in children. So, and it is usually caused when the immune system is hypersensitive or overreacts to a substance that is not harmful.
Good morning, parents, children, and colleagues. I am respiratory therapist, Ms. Kunjal. I will be talking to you on the causes of asthma in children. So there are 3 main causes. The first one, genetics. Genetic asthma can pass down from family generations or a parent present or diagnosed with asthma. Allergens, environment exposure, example, polluted air caused by exposure to ozone, dust, or tobacco smoke can lead to asthma in children. And also there's the viral infection at young age, example, respiratory infection affecting breathing.
Thank you, Ms. Kunjal. Good morning, parents and children. I'm pulmonologist Mitchell, and today I'll be speaking about symptoms and also risk factors that occurs with asthma.
Well, the lungs and airways become readily irritated in children with asthma when exposed to particular triggers, such as breathing pollen or contracting a cold and other respiratory symptoms that interfere with play, athletics, school, and even sleep. Uncontrolled asthma in some children may result in life-threatening asthma attacks. Typical symptoms of childhood asthma include recurrent coughing that intensifies with a viral illness, happens during sleep or is caused by exercise or cold air, a whistling or wheezing sound heard while exhaling, shortness of breath, congestion or tightness of chest, breathing difficulties that impede sports or other activities. Risk factors of asthma include the inhalation of secondhand smoke, a history of allergic reactions or asthma in the family, even by living in a location with a high concentration of pollutants, being overweight or obese, conditions related to respiratory system such as persistent runny nose or stuffy nose. Now I pass you on to my colleague.
Thank you, Ms. Mitchell. Good morning, boys and girls, and all you mummies and daddies. So I am Dr. Mohammed, and I am a senior dietitian right here at the local health center. So now we want to look at how asthma is diagnosed in children, right? So there are different tests that can be done. One of the tests is a spirometry test, and this uses a spirometer, which is used for checking how well the lung is functioning, right? Another test that can be recommended is the peak flow meter test. This test uses a small device that is easily transported, and it is used to measure how fast a patient can blow out of their lungs with a forceful exhalation. Now, this test will give you a general idea of how narrow the airways are, and it can also show you how the airways may be developing and changing over time by measuring the peak flow every day, right? Now, another test is the bronchoprovocation test, and also imaging tests like a chest x-ray can be done to diagnose asthma. Now, in terms of treatment and therapy for asthma, there are medication, there are non-medication treatment, and also diet therapy that is used to treat and lessen the occurrence of an asthma attack in your child, right? So there are many long-term medications that will help to reduce the inflammation in a child's airway. So drugs like fluticasone, mometasone, Zyflo, Accolade, Cereferent, and Symbicort, all these are used as long-term control medications for asthma. There are also quick relief medications such as albuterol and levolbuterol, which can be used depending on the severity of the attack, right? Now, simple non-medication treatment would involve things such as yoga to help the child relax and even learn breathing techniques. Parents, you can do tracking the child's symptoms with a written plan and also controlling the asthma triggers, right? Now, in terms of diet therapy relating to asthma, if the child happens to be obese or overweight, then a special diet may be recommended. So I will be the one to be tailoring the diet for the child specifically, right? But in general, parents, you want to encourage your child to have omega-3 fatty acids, antioxidant nutrients, and magnesium. All these are substances that should be encouraged for the child to consume, right? Now, omega-3 fatty acids help to reduce inflammation, and it decreases the bronchoconstrictive leukotrienes. So some foods containing the omega-3 fatty acids would be things like chia seeds, they have flaxseed, walnuts, kidney beans. All these are good sources for the child to consume. Additionally, the antioxidants are man-made or natural substances that may prevent or help delay some type of cell damage. So these antioxidants can be found in all the fruits and the vegetables, well, some of them, right? So you may want to get your vitamin A, C, E, your beta carotene, and your lycopene from all these rich sources of your vegetables and your fruits, right? So please eat your fruits. And also magnesium is another substance you want to include, right? Because it is a bronchodilator and it helps to relax the smooth muscle, while it also acts as an anti-inflammatory agent. So some foods containing magnesium would include things like spinach, pumpkin seeds, almonds, avocado, and yes, chocolate as well, but the dark chocolate is best, right? Now, just as you want to encourage some foods, you also want to limit or restrict other foods. So for parents, omega-6 fatty acids, this should be restricted, as omega-6 is a pro-inflammatory agent, and it will increase the asthma attack, as it can also inhibit the anti-inflammatory and inflammation effect that you will get from the omega-3 fatty acids. So you don't want to give them too much omega-6 because it will counterattack what omega-3 is supposed to do, right? Now, seafood, shrimps, and fish can also trigger an asthma attack, especially for those who are allergic, and you also want to limit it for the children who are not allergic as well, right? Now, fish contains a protein called parvalbumin, which is known for causing allergies in some children and even adults, so you want to keep it at a minimum. Another food to avoid would be things like food additives that would contain sulfites. So sulfites is a type of preservative that is used to preserve dry fruits and processed foods. So some foods you want to have the child avoid would be things like pickled foods, packaged potatoes, dry fruits, and vegetables. You want to get the vegetables fresh and the fruits fresh as well, right? So I will now pass you on to my colleague who will also go in depth with another key component in understanding asthma.
And for the big question, how can asthma be prevented? So asthma cannot be prevented, but there are steps you can take to reduce the risk of asthma in children. These are keeping the environment at home clean, distancing the child from areas of air pollution, and ensuring the child is healthy and also maintaining a healthy weight. I'll now hand you over to my colleague.
Good morning, parents and children. My name is Ms. Palu, and today I am going to discuss who do we need to call for help in case of an emergency. So if your child starts exhibiting severe symptoms while breathing, walking, talking, or sleeping, you should get in touch with your primary care physician or the emergency department at 811. I'll now hand you over to my colleague.
Okay, so we just want to do a little presentation on how you would actually use the inhaler properly, but before, we just have something or like a little funny video to show you on how you will not use the inhaler.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Okay, so kids, make sure that you will not do what you saw in the video. So now, the respiratory therapist, Ms. Kunjal, will be here helping me and demonstrating how you would actually use your inhaler. Okay, so step one, you want to take the cap off and you want to make sure that the mouthpiece is clear. Then, you want to make sure that your primary inhaler, so you will shake it around 10 to 15 times to make sure that the medicine is well mixed. Then you want to breathe out as much as you can. Step 3, you want to position the inhaler at the opening of your mouth and make sure that your lips make a tight seal. Then you want to breathe in, and then you want to press down on the tongue at the top of the inhaler and hold your breath. Then you want to remove the inhaler from your mouth and continue to hold your breath as long as you can. Then you want to finally breathe out. So great.
So now we are going to have an evaluation by asking 2 questions, and whoever gets it right will get this choice, okay? So the first question, can you identify one test that can be performed to confirm that a child has asthma?
Auntie,
Yes.
it's a chest x-ray.
Yes, that's correct. And the second question, can you name 2 control medications that are used to help and control and prevent symptoms and reduce the frequency and severity of exacerbations?
Auntie, is it Zyflo? And
Yes.
Symbicort?
Okay, very good. Very good.
Good job.
So this brings us to the end of our teaching session. I would like to thank our lecturer, Ms. Patricia Diet, for providing our group with a tremendous opportunity to speak about our research topic on childhood asthma. Thank you to our audience for your undivided attention. Thank you to our team members for making this a tremendous, successful teaching plan. I hope that you have gained something from our lesson so that one day you will be able to assist or advise someone who needs help.